Miss Williams?
Yes.
I'm May. I'm going to be your PA, and I'm just going to talk to you about what's been going on. My doctor told me that you've been wanting to, or you've been thinking about like the effects of smoking and how it's affecting your daughter Amy.
Yeah, she just keeps coming in with ear infections, and so I just don't know if that has anything to do with it.
Okay. And so she's only 6 months old, correct?
Mm-hmm.
Okay. How's her health otherwise? Has she had any other problems?
I think other than that, that's been about it.
Okay. So how during your pregnancy with her, did you quit smoking or?
Well, I began smoking when I was about 12, and I've been a pack-a-day smoker ever since.
Okay.
And I've never tried to quit, even though my obstetrician has told me to.
Okay.
I never was able to. And
which kind of makes sense because you've been smoking for more than you can remember.
Exactly.
So you started at 12, and that's kind of all you know, and that's all your body knows.
Yeah.
So I can understand that.
So I smoked through the entire pregnancy.
Okay. And did you experience any severe complications in the pregnancy, or any problems when you were going through the pregnancy?
No.
No.
Not that
Okay.
I know of. My mother always told me that smoking helps deal with her problems, so I figured that helps me cope with stress as well.
Okay. And so did you? I'm not sure if you said this already. Did you try to quit during your pregnancy, or did you just continue and hope for the best?
I just continued.
Okay.
Yeah.
And is Amy otherwise healthy? You did mention that she's otherwise healthy besides these ear infections that keep happening, right?
Yeah.
Okay. Do you know how many have happened approximately? Just a bunch.
Just several,
okay.
3 or 4 maybe.
Okay. And that is concerning because if she's had 3 or 4 and she's only 6 months old, that means that they're happening very often. And I can understand that because you've been smoking for a really long time, it's really difficult. And you said that it's something that you just use to stress or to cope with your stress. But I do want to talk to you a little bit about the effects that can occur for Amy long term. And I know that as a mother, the reason you came in today is because you're concerned. Mm-hmm. And that is the first step. So I would like to really acknowledge that. And that's awesome that you're here. I just would like to, just get you to start thinking about some of these are just the ear infections that are happening, but you could be putting Amy at risks for other things as well, such as just exposure to the smoke that you that she would be exposed to, regardless if you're smoking in the house or outside of the house, can affect her growth. And she's only 6 months old, so that's something that obviously you are concerned about. It seems like, am I understanding? Yeah. So so I would actually would like to ask you would you be interested in quitting?
I think I would be if it was for Amy's health.
Yeah. Just because not only is it affecting her ear infections, and like I said, it could cause some growth abnormalities, but it could also put her at risk for lung cancer in the future. Because one of the risk factors for lung cancer down the road for her could not only be if she smokes herself, but if she's been exposed to all the secondhand smoke. And like I said, the secondhand smoke is not only you smoking when she's around, but it could also be on your clothes and in your hair. And as much as a lot of my patients try to avoid all those things and go outside and make sure they're not exposed to their baby, the particles of nicotine do stick around, and they will transfer. And one of the major things are recurrent ear infections, which we're seeing with Amy already. Mm-hmm. So I'm a little concerned, and I know that you are too. And so I would just like to talk to you about how, if we'd like to, set a plan for you, and not necessarily thinking about quitting right away, because that's something that, you've been smoking is basically your life for a really long time now. So just thinking of a plan,
Yeah, I would definitely like to do this for Amy.
Mm-hmm.
I had no clue that, even though I was smoking outside of the house, that this could still be affecting her in this way. So
right.
I didn't know that is what could have been causing it.
Right.
My only thing is dealing with my stress, being a single mother.
Mm-hmm.
And having Amy so young.
Right.
I feel like I'll need other coping mechanisms to.
Yeah. Absolutely, and I understand that like this is going to be something that is going to be a process for you, especially because like I'm like when I talk to any of my patients about smoking, in the beginning it is a really stressful process, but it's a lot of it is just like, you know, constantly overcoming that struggle, and it's a process. And there are lots of different ways. I know you haven't tried before, but there are lots of resources out there and lots of ways that we can try to come up with a plan for you that'll help you and see what works and what helps you maybe deal with the stress a little bit differently, you know?
Yeah.
So a lot of times, like you said, that you use this as a coping mechanism for your stress. Do you know if it's... So how many times this day would you say that you smoke?
Well, when I wake up in the morning before I go to bed, like, I mean, I take breaks throughout work.
Okay.
Like, it's maybe like once every 2 hours.
Okay. So how is it is it that sensation of you like picking up a cigarette and putting it to your mouth, or like what exactly do you know? Like what?
Well, I just feel like jittery. Like if I don't have,
okay,
I guess the nicotine in me, like, and if it starts to wear off, I can feel it, and then I need to go smoke outside.
Okay, and so the people at work, do they also smoke?
Yeah, a lot of people at work smoke, and like I have my friends that I go outside and smoke with, and my mom smoked 2 packs a day for over 30 years, and my dad smokes, but he doesn't smoke in the household. And then my mom's current boyfriend is a smoker, so everyone's just a smoker. It's like a stress reliever and like a social aspect of my life.
Okay, and all like your mom, your dad, and like the other people, are they surrounded, or do they come in contact with Amy frequently as well?
Yeah.
Yeah. So okay, so that would also be another concern aside from your smoking, is like just all of the different nicotine that is being exposed to Amy, and she's in for her 6-month checkup, so that's good. Like she's doing well besides the ear infections, but I'm very concerned about just other like the buildup of nicotine that she's being exposed to, because basically you guys are her caretakers, and you guys are who she's exposed to. And like I said, it's not just about how much exposure is direct on Amy. It's like sometimes you could be carrying it on your clothes, you know, without even thinking. But I understand that you're like surrounded by not only your family but people at work as well. So that's also another challenge that I'm just trying to address for you.
Yeah, I mean, I can mention it to them, but I mean, I think as for now, I'm the only one we can work on.
Yeah, and that's fine. We just need to, you know, come up with all of like a list and like a mental list of all the things that are going to be hard. Like it's going to be a difficult process, but like I said, like all you got to focus on is you're doing it for Amy, you know, and you're doing it for her health. So like I said, there are different patches and like gums and lozenges that we can use as nicotine replacement. And if that's something that you are interested in, we could definitely talk about different treatment plans. There's also resources such as like phone calls that you can make every time you have the urge and like those jitters, you know. So we can come up with a plan for you using multiple resources and see like what works and what doesn't work. Because I'm going to be honest with you, all the patients, it depends patient per patient, because everyone's been smoking for a different period of time. Everyone smokes for a different reason, copes with stress differently. So we're just going to have to come up with something that's specific to you, and we'll try different methods, and it'll be a process. But I think it's really great. The first step of this whole process is that you're here. So I would really like to, like, you know, acknowledge that and like commend you for coming in here, taking the initiative for Amy's health, because this is where it starts. And yeah, I'm like really happy to talk to you about like a treatment plan specific for you. So
okay, that sounds good. So where do we go from here?
So I would like to, after Amy's visit today, I would like to set up an appointment specifically for you and think about setting up a treatment plan and thinking about, I don't want to jump on quitting right away, but let's see if we can work towards quitting, you know, like maybe cut down a little bit and come up with a specific plan, and not just throw it out in the air and just be like, okay, you're going to try your
Yeah.
best not to, but let's quantify it.
Okay.
So you said every 2 hours, let's try to make it, every 6 to 8 hours, and like let's try to wean you off of it. That way your process will be a little easier for you.
Okay.
And like I said, there are like different gums, like lozenges, different things that we can try, as well as like support groups and like those hotlines that we can try as well.
Okay.
But I would like to have another appointment so we can just talk about a specific treatment plan for you.
Okay.
Okay,
Sounds good.
sounds good.
Thank you
Okay,
for your help.
no problem. Thank you.